WNYT, Albany, in HD. News Channel 13, live at noon, begins right now.
Good afternoon. Thank you for joining us. I'm Sabrina Dami. We have a big announcement involving two Capital Region hospitals. Ellis Hospital and St. Peter's just announced they will be working together. Health reporter Benita Zahn is in Schenectady, where the announcement was just made. Benita, good afternoon.
Good afternoon, Sabrina. Let me be clear at the outset. This is not a merger. Rather, this is something called a clinically integrated network. It's bringing the hospitals and it's bringing physicians in the community and pretty much anybody who is a healthcare provider, bringing them together to share information and then utilizing that information in the best way to give you the best treatment. With me now are the CEOs from both hospitals, Jim Reed from St. Peter's Health Partners and Jim Connolly from Ellis Medicine. For the consumer, they hear that you two organizations are teaming up, doctors are teaming up. What will this look like to them when they go to the doctor's office?
Yeah, initially, patients won't see a change. They'll see their physician, their physician will care for them. They can come to our institutions and so forth if they need that level of care. But behind the scenes, this will give us an opportunity for a variety of groups, independent physicians, physicians within our own organizations, our hospitals and other facilities, to work together in a way where we can coordinate not just information, as you mentioned, but also what are best practices, what are the best pathways for caring for someone, where are the gaps in their care, so that the physician can know that right away and fill in those gaps.
You were saying that this should help put the cart, and the horse in a better alignment so that we can do more preventive care. And Jim, you also indicated that this differs from mergers. You didn't become a secondary player here, but rather this is open. And what do you mean by that? Why is that important?
We thought it was very important that we need to have an open structure for this, because this doesn't begin or end with just St. Peter's and Ellis. This has to be a community-wide effort, a lot of community partners that had to be able to join in on this, and we wanted them to feel like when they joined us, they were going to be equal partners with us. So it starts with us being equal partners with each other. So
down the road, ideally, everybody starts sharing information. The goal is to help get us healthier and save some money and keep us out of the hospital.
Absolutely. We know that the care needs to occur out in the community. We just need to provide the method for bringing people together to do that.
And we know this won't happen tomorrow, but perhaps a few tomorrows from now. And of course, I'll have more on this for you tonight, live at 5 and live at 6. Jim Reed, Jim Connolly, thanks very much. All the best as you bring and wrangle all of this together to try to and help keep us healthier. Sabrina, that is it here in Schenectady. I'll have more on this story tonight, live at 5 and live at 6. Back to you.
All right, Benita, live in Schenectady. Benita, thank you.
Two local hospitals partner up in the Capital Region. St. Peter's and Ellis Medicine are teaming up to change how health care is provided in the area. How this will help patient care coming up.
You're watching Time Warner Cable News all day.
It's not a merger, but two hospitals are partnering up, hoping to change how health care is provided in the Capital Region. Representatives from St. Peter's and Ellis Medicine announced their new alliance during a press conference Tuesday. The partnership will allow doctors from both hospitals the ability to coordinate patient care through an integrated network. Physicians will be able to view patients' medical history from both hospitals, allowing them to treat more efficiently and at a lower cost.
Ultimately is decreased utilization of our healthcare resources. That's what's costing us all the money, is this very heavy utilization of the healthcare system. How do you do that? You basically do these kinds of things, clinically integrated networks and so forth.
As we develop our competency and we demonstrate that we can do this, I think there may be other people that will come and join us. And again, the design of this is an alliance. We want to be inclusive and welcome people who want to participate.
Our patients utilize St. Mary's, but they also utilize Ellis and St. Peter's and Albany Med. So now locally driven care is across the whole region. And somehow we've got to better manage care across an entire region. So I think that's probably one of the most critically important elements about this whole venture.
The two hospitals will also seek to offer a Medicare program called an Accountable Care Organization. The ACO benefits doctors and hospitals that work together.
Dedicated, determined, dependable. This is News 10 ABC at 4.
Well, happening today, 2 regional healthcare systems announcing an alliance to explore ways to improve healthcare and reduce costs. Ellis Medicine in Schenectady and St. Peter's Health Partners in Albany. They're going to work with physicians on this initiative. Together, they're creating a clinically integrated network, or a CIN. The physician-led network will allow private groups, along with health centers, to work together, coordinating the delivery of medical care to you, as well as participating in the new methods of payment.
Both of our organizations, like health systems across the nation, are continuously talking with everyone, including physicians, hospitals, and health insurers, seeking the best practices and the best opportunities in this ever-changing landscape.
Healthcare providers say this partnership is meant to explore clinical and financial opportunities, but they stress it is not a merger.
This is News Radio 810 and 103.1 WGY AM Schenectady, WGY FM Albany, the Capital Region's news, traffic, and weather station.
It's not a merger, but Ellis Medicine and St. Peter's Health Partners launching a new joint venture designed to control costs and improve the quality of healthcare services called a clinically integrated network, and will allow physicians and staff from both facilities to find the right way to care for patients in this new Obamacare environment.
News Channel 13, live at 5, begins right now.
St. Peter's Health Partners and Ellis Medicine are partnering on a new project. It's not a merger, rather an alliance which includes physicians sharing information and best medical practices to improve delivery and reduce the cost of care. It also helps to satisfy something called Triple Aim, developed by the Institute for Healthcare.
To better serve our patients and assure they get the best quality of care, to improve the overall health of the communities we serve, and to lower the rising costs of health care.
That's why St. Peter's Health Partners and Ellis Medicine are creating a clinically integrated network known as a CIN. It's an outgrowth of the Affordable Care Act, which aims to tamp down the rising cost of health care and improve overall care. This CIN is called the Innovative Health Alliance. It's a limited liability company, so it legally allows hospitals, doctors, and other health practices to work together to share your health information and best medical practices with the goal of enhancing the quality, access, and reliability of care. And it helps organizations share costs and risks.
Patients probably won't see, per se, a difference.
But their doctors will. With more access to patient records, they'll see where treatment gaps or redundancies exist, with an eye to getting a jump on disease to rein in trouble.
We're excited with the opportunity in front of us to collaborate and transform healthcare in our region, and this groundbreaking alliance will work to improve the health and well-being of all our neighbors.
This alliance will also create an accountable care organization to become part of the federal Medicare Shared Savings Program. If the feds approve it, it goes online early next year. The rest of this collaboration is expected to take more time and evolve as healthcare evolves. Other healthcare organizations are already looking to join this CIN, and I'll have that part of the story and Albany Med's response to all this live at 6.
This is CBS 6 News in high definition. Two of the top Albany region's largest hospital systems, St. Peter's Health Partners and Ellis Medicine, plan to join forces under the latest partnership that's reshaping the healthcare landscape here in New York. This is all a result of the Affordable Care Act, which encourages these collaborations through financial incentives. It's a way to cut costs and provide better care. St. Peter's, the largest private sector employer in the area, already commands 47% of the market share in the region, whereas Ellis ranks third based on patient days. Under the proposal, they would share services and resources, but still remain two independent operations.
This is News 10 ABC at 5:30.
The two regional health systems have announced an alliance.
They say this will improve health care and reduce costs. John Gray joins us now with the details. John?
Well, Lydia and Mark, this involves two of the major players in local health care, not merging so much, but sharing information and sharing resources. Ellis Medicine in Schenectady and St. Peter's Health Partners in Albany going to work with physicians on this initiative. Together, they'll create a clinical integrated network, or what they call a CIN. This physician-led network will allow the private groups, along with health centers, to work together in coordinating the delivery of medical care. And the doctors behind this say the patient is going to be the big winner.
Physicians who have these systems already in place, I would be seeing as a physician all your visits, everything that you've been involved in, the cost of your care to the system, any gaps in your care. Are there things that we should have been doing that I haven't done that I kind of thought were being done? And those are what we call best practices and clinical pathways.
Now, the two things they want to stress here, it's not a merger, and most patients won't even notice any change at all, except hopefully they're going to see even better care and better attention. Mark.
All right, thank you, John.
You're watching Time Warner Cable News all evening.
Merger, but two hospitals are partnering up, hoping to change how health care is provided in the capital region. Representatives from St. Peter's and Ellis Medicine announced their new alliance during a press conference Tuesday. The partnership will allow doctors from both hospitals the ability to coordinate patient care through an integrated network. Physicians will be able to view patients' medical history from both hospitals, allowing them to treat more efficiently and at a lower cost.
Ultimately is decreased utilization of our healthcare resources. That's what's costing us all the money, is this very heavy utilization of the healthcare system. How do you do that? You basically do these kinds of things, clinically integrated networks and so forth.
As we develop our competency and we demonstrate that we can do this, I think there may be other people that will come and join us. And again, the design of this is an alliance. We want to be inclusive and welcome people who want to participate.
Our patients utilize St. Mary's, but they also utilize Ellis and St. Peter's and Albany Med. So now locally driven care is across the whole region. And somehow we've got to better manage care across an entire region. So I think that's probably one of the most critically important elements about this whole venture.
The two hospitals will also seek to offer a Medicare program called an Accountable Care Organization. The ACO benefits doctors and hospitals that work together.
Now on WNYA, My 4 in HD. This is News Channel 13, live at 10.
And a new partnership between St. Peter's Health Partners and Ellis Hospital. What they plan to do to bring you more cost-effective and efficient medical care. St. Peter's Health Partners and Ellis Medicine partnering on a new project. Today, they're creating what they call a clinically integrated network. Physicians will share information to improve delivery and reduce the cost of care.
We're excited with the opportunity in front of us to collaborate and transform healthcare in our region, and this groundbreaking alliance will work to improve the health and well-being of all our neighbors.
This alliance will also create an accountable care organization to become part of the federal Medicare Shared Savings Program. If the feds approve it, it's to go online early next year.
News Channel 13, live at 11, begins right now.
St. Peter's Health Partners and Ellis Medicine are teaming up for a new project. It's not a merger, it's more of an alliance. Doctors will share information and best medical practices to improve delivery and reduce the cost of care. Hospital administrators say that patients probably won't even notice a difference.
We're excited with the opportunity in front of us to collaborate and transform healthcare in our region, and this groundbreaking alliance will work to improve the health and well-being of all our neighbors.
We also reached out to Albany Med for comment, and in a statement they said, quote, similarly, Albany Medical Center is working with dozens of partners throughout the region on initiatives aligned with Medicaid waiver programs that will improve care in a broad geographic area.